My name's Beth Mathis, and I am the kynect team leader at KIPDA. I would say a lot of my focus has been on the reentry community. Pre-COVID, we would go into the prisons and do a monthly reentry class. We would go in once a month, work with folks who were about 60 days prior to release, and help them complete an application for Medicaid. So they would have access to health care, mental health treatment, substance use treatment, things like that. Medicaid is very important to cut back on recidivism because we know from much of the population who has been incarcerated, they struggle with mental health at a higher rate than the general population. We also know that many of them may have a history of substance use. I always thought when I started this job that if I were leaving incarceration and about to be released, the last thing on my mind would be health insurance. Maybe restarting relationships with my family, getting a job, getting a place to live. But a reentry person enters the community without access to health coverage, and they may have mental health struggles. You can't take care of your mental health if you can't take care of your physical health. I think it's important for people in the reentry community to be covered because it gives them a second chance. It gives them the opportunity to maintain their physical health or improve it if needed. It gives them the opportunity to seek out mental health services, behavioral health services, counseling. It gives them access to case management so they can minimize the risks of food insecurity and homelessness, minimize the risks of reincarceration. We know that individuals who don't have access to health coverage or mental health treatment after release have a much higher rate of returning to prison. We want them to have a second chance, and if they are mentally and physically healthy, their children are going to be mentally and physically healthy and have less risk of incarceration. Everybody should be able to live their best life for as long as possible. If one member of the community is sick, it affects us all. We're only as healthy as our weakest member.